Simplicity and safety come together for you in the BD Autoguard family of shielded IV catheters. The BD Autoguard shielding technology, along with your choice of catheter material and other features, allow flexibility to meet clinical preference while putting safety right at your fingertips. Remove the needle cover in a straight outward motion. To release the tip seal, hold the colored hub stationary and rotate the clear safety barrel 360 degrees until the catheter reseats against the safety barrel. The white button will now be facing upward. This also orients the bevel. Failure to release the seal may affect catheter advancement and proper needle retraction. Apply traction to the skin to stabilize the vein and prevent it from rolling away from the needle tip. Approach the vein slowly at a low angle and perform the venipuncture. Watch for blood return in the flash chamber. Flash indicates that the tip of the needle has entered the vein. To ensure that the catheter tip is also within the lumen of the vein, lower and advance the entire catheter unit forward slightly. Lowering the catheter angle reduces the likelihood of posterior wall penetration. Remember that in 20, 22, and 24 gauge catheters, the notched needle provides immediate detection of blood return along the catheter tubing at the insertion site. Blood return will continue to progress into the flash chamber as with traditional catheters. The catheter can now be advanced into the vein. Hooding allows one-handed advancement of the catheter while protecting the vein from the needle tip. To do this, place your index finger on the push tab located on the catheter hub and advance the catheter into the vein, approximately 1/4 inch. Then, advance the catheter and needle as a unit up to the hub. Now remember, keep traction on the skin with your opposite hand. To minimize the flow of blood from the catheter hub once the needle is retracted, remove the tourniquet and apply digital pressure beyond where the tip of the catheter resides within the vein. Applying digital pressure directly over the catheter may damage the vein and result in blood exposure. When ready, stabilize the catheter hub and push the white button. The needle is now completely encased within the clear safety barrel, providing visible confirmation that the device is activated. The safety barrel should be disposed of into a puncture-resistant, leak-proof biohazard sharps container.
Release the tip seal prior to insertion. Lower the insertion angle so the catheter is almost parallel to the skin surface. Approach the vein slowly. Decrease your penetration force through the skin. With BD catheters, you'll feel a loss of resistance rather than a pop when entering the vein. After visualizing flashback, lower and advance the entire catheter unit forward slightly, then advance the catheter off the needle into the vein. When looking for flashback, trust your instincts. If you think you're in the vessel, pause and look for flashback behind the white button. In the 22 and 24 gauge catheters, watch for initial flash within the catheter tubing near the insertion site. Be aware of patient factors that might affect flashback, like the vein condition, a small patient, low blood pressure, and dehydration. To successfully thread the catheter into the vein, avoid pushing the catheter forward while pulling the needle out. Maintain traction on the skin as the catheter is advanced into the vein. To ensure needle retraction, apply digital pressure beyond the tip of the catheter. Digital pressure held over the catheter may put pressure on the needle, preventing retraction. Do not lift up on the safety barrel or bend the needle while retracting. Techniques to minimize the flow of blood from the catheter hub include removing the tourniquet before retracting the needle and applying digital pressure beyond where the tip of the catheter resides within the vein. Digital pressure held over the catheter will not occlude the flow of blood and may cause damage to the vein. Have IV tubing or other connections within easy reach.